Good evening. This is the monthly North Andover Board of Health meeting, Thursday, June 24th, 2021. It's 7 p.m. I'm Joe McCarthy, Board Chairman, and we have a quorum. On my left is Dr. Patrick Scanlon. He's a town physician. And on my right is Dr. Max Tilson. They both like to be referred to by their first name. Not here tonight is Michelle Davis. She's in Florida, and also Daphne LaFleur. At that, also too, in the department over here to my right is Brian Lagrassi. He is the director of the Department of Health. To his right is Steve Casey. He's the inspector. To the far left here is Carol Ibbison. She is the town nurse. And way over there, you probably can't see her, is Tony Wolfenden. She is the department assistant. At that, meeting's called to order, and the first order of business is the Pledge of Allegiance. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right.
Now, the board clerk, Michelle Davis, she is not here right now, but I do know that she has critiqued the minutes of last month's meeting, May 13th, and I also reviewed the minutes too. So we need a motion to accept the minutes.
I'll make a motion.
Okay?
I'll second it.
Okay. All those in favor say aye.
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 Okay. Minutes accepted. New business, Board of Health elections. Elections every June for offices, that is the chair and the clerk. I do know that Michelle Davis is interested in maintaining her position for this year, and I'm open to maintaining my position too. But I'm not going to get involved in discussion at all, but I will turn it over to.
It's going to be a heated discussion.
It is.
Very. I make a motion to nominate Joe McCarthy as chairman and Michelle Davis as clerk for the next upcoming year.
I'll second that.
Thank you. And I know that the other two have somewhat supported me too. I'm not quite sure whether or why I have support.
You have to vote.
Huh?
You have the vote.
Oh, we have to vote. Okay, those in favor say aye.
Aye. I don't know.
Okay,
if I
those opposed say no.
There you go.
But I'm not quite sure why I have this type of support. I know that I've been on the board as long as all the other four members combined. But I also know that I'm very old, and they may be feeling sorry for me, and they
Yeah, sympathetic.
wanted me to stay on the board for another year. So I will do that, but just for one more year. I'd like to change the order of discussions right now. Before we get to the short and long-term priority assessment, I want to talk about the COVID-19, because the priority assessment is going to take a little time, and I'd like to keep that to the end. And I'd like to turn it over first to you, and then you may want Steve and Carolyn to interject too.
Thank you.
So it's yours.
All right. As you guys know, things have definitely wound down, obviously being in your professions. State of emergency ended on June 15th, so all the restrictions have been lifted. There's still some general guidance out there in terms of recommendations, such as for people who don't feel safe, haven't been vaccinated, they are encouraged to wear masks if they so choose, but it's not required anymore. Mask orders have been lifted and things like that. So where we are now is, as a state, they're still doing some minimal testing. We had about 27,000 tests yesterday. 68 cases across the state, which is a 0.3% positivity rate, which is still really good. In total, across the entire pandemic, Mass has seen about 663,000 positive cases through the past year and a half, which is still about 10% of the population in the state. So it did move through the state fairly efficiently for the past year and a half. 4.1 million people in Massachusetts have now been fully vaccinated. So it's 2/3 of the entire state have been completely vaccinated. And as you guys know, the vaccines are extremely effective, and it is doing its job. So that's really good to report. In North Andover, we have 0 cases as of today. So there are no positive cases. Nobody's on isolation. We have no close contacts or quarantines at this point. Our vaccination rates are fantastic. I think and this is, obviously, it's an ongoing process with first doses and second doses. So for 75 plus, which is the hardest hit population, we are at 95% 1 dose, 88% 2 doses. So
Residents, North Andover?
correct. Yep. 65 plus, we're at 92%. 50 plus, we're at 84%. 30 to 49, we're at 79%. Ages 20 to 29, we're at 72%. 16 to 19, which is obviously only available through Pfizer, we are at 62%. And the middle schoolers, age 12 to 15, we're at 65% vaccinated first dose. Their second doses were at a clinic a couple weeks ago at the middle school, and obviously they'll be getting their second doses for the percentage that didn't get those doses yet. So for a total population, we are at 68% 1 dose, 61% 2 doses. As an entire population, which includes 0 to 12, which isn't, or 0 to 11, which isn't allowed at this point. So, so far so good. Things have been moving along. We've seen the cases drop. Vaccination rates are up. Vaccine is readily available at any drugstore, any CVS. Primary cares have it. The mass vaccination sites are winding down at this point, but it is still readily available. So we do encourage people to get vaccinated if they so choose. So throughout the pandemic, basically we've seen 3,000 cases in town here. 3,043 to be exact, out of almost a population of 32,000. So our infection rate was about 10%, really low. I think one of the things that we definitely are happy about is the mortality rate was extremely low here in town. I think access to medical care, I think all the protocols we put in place definitely helped. It was a 0.3% mortality rate, which is extremely low. There are some diseases in the area that come around every year that have a higher mortality rate. That I think really puts in perspective everything that was done was effective. We now have our vaccination rates extremely high, and we have 0 cases. So this is our first in-person meeting without masks. I think this is a big step forward. We're actually close to each other again, can shake hands. And we're getting back to our regular workload. So for all the things that we did with all of the protocols and guidance and working with businesses and schools and town departments and residents through the past year and a half, that's definitely wound down. And everything else that we used to do on a regular basis, which it's kind of refreshing to have again, is coming back full scale and with a vengeance at this point. People are out and about and getting back to business. And I will pass it off to Steve, who has been extremely busy in the field, playing catch up with all the new construction and everything going on right now. So we're getting back at our regular pace of work again, which is.
Before you pass it to Steve, what is it? Are we at herding right now in Massachusetts?
Well, I mean, I'm not sure what the vaccination rates around the state are. I don't know if you have those, but
I don't have those with me. I can get them.
yeah, but I think that if we're not there yet, we're certainly pretty darn close. I mean,
Well, the vaccination rate in the state, fully vaccinated, is in excess of 4.1 million people. In addition to that, about 10% of the population, which is in excess of 600,000 people, have had the virus. So with the vaccination rate and the 10% of the population that have been affected, and that the total population of Massachusetts, I believe, is slightly in excess of 6 million people. So we arguably right now are somewhere around 80% fully vaccinated in Massachusetts or haven't had the virus. And that is a number that I've heard all along, somewhere between 70 and 90% for herding. I would think that we are there, or if not, they're very close right now. Certainly, the statistics show that.
Yeah, I
The
think-
numbers are way, way
Yeah, I
down.
think with the amount of people that are vaccinated, plus the amount of people that have had it, so they have natural antibodies, you're at the 70, 80% at this point, and the virus doesn't have a lot of viable hosts that will incubate it and shed it. So it drops off just as fast as it picks up at the beginning. And I think we're at that stage now since we have 0 cases in town. Can things change? Of course, but I think even the variants that they're talking about that are out there and spreading around are still effectively covered by the vaccines that we have. And I'll let the physicians talk about that in more detail, because they know a lot more about it than I do.
Probably not. I mean, I will say that the only caveat I will throw into that, Joe, is that we do not live on an island in Massachusetts. If these borders had had water around it and no one could get in here, then we would be free for all. We're done. We're out. I think the thing to remember is that not every state is at 80%, and that we could easily if the state becomes an attractive, say, vacation destination because we're so wide open and because we are apparently so hurt because we're so immune. It wouldn't take much to dilute us down below 80%, if that makes any sense. So if people say from a non-vaccinated place come here and are non-vaccinated and come here, then we're not in a herd anymore. So I wouldn't say that we have sailed through the I wouldn't say that we're done with the pandemic. I don't believe that. I think that we're not done with the pandemic until our world is done with the pandemic. I think we're still a bit able to have problems if we're not vaccinated. So if people are not vaccinated yet, they shouldn't say we're at herd immunity, we don't need to get vaccinated.
Well stated. Patrick, you have anything you want to add to that?
I actually listened to the Mass Medical Society hosted Dr. Fauci last month, their annual big lecture that they do, and I was listening to him, and he was outlining basically everything that has kind of gone on. The one thing that he did point out is that Pfizer and Moderna well cover the Delta variant, which is the new variant in the news. And the Johnson & Johnson vaccine, the studies are ongoing, but he anticipates that the data is going to be just as positive as the Pfizer and Moderna vaccine. So the big concern really right now is lower vaccinated states, like Max was saying, and coming up here, and even us traveling down to other lower vaccinated states.
Callan, are we still vaccinating people?
We don't
Yeah.
have COVID vaccine because the state stopped giving it to
Well, that's a good reason
health
that we're not
departments.
doing
So,
it.
so we stopped vaccinating, but for the middle school and the high school clinics, we partnered with a pharmacy out of Waltham, Pelmeds, and they came with the vaccine, and we supplied the arms and the location, and that's how we got about 460 middle schoolers vaccinated, and they're fully vaccinated now, and I think a little under 200 high schoolers vaccinated. But I think what Cheryl Barzak was saying was that I think she has almost 1,000, I think 975 high schoolers vaccinated, which is great.
I'd like to talk about that just for a moment before we turn it over to Steve and you, because a question that's just been gnawing at me for like the last week or two, and I'm going to look at a few notes that I have here. The World Health Organization says that people 18 years old or younger should not be vaccinated against the virus because the risk outweigh the benefits. And researchers in Israel found that the vaccine could increase the risk of inflammation of the heart muscle, which is myocarditis, and inflammation of the lining outside the heart, which is pericarditis. Actually, those problems may increase by a multiplier of 25. Multiply by 25. Furthermore, the CDC has just acknowledged that there is a direct correlation between the vaccinations for this virus and heart issues. I don't believe that they've gone any further than that at this particular time, although I could be mistaken. So, I don't want to put anyone to say one way or the other, but it certainly doesn't warrant further discussion and consideration, because I'm hearing things and reading things that are very different than what the politicians are telling us. So I don't know if kids 18 years of age or younger should be vaccinated, based upon what the WHO and the CDC are saying. I
CDC
simply don't know.
The CDC just came out and said that the benefits outweigh the risks.
I heard them say that there was a direct correlation, but they didn't say the benefits, but I'm glad to hear that. So what the CDC is saying is inconsistent with the World Health Organization is saying.
Yes, I mean, I didn't know that the World
They
Health
did.
Organization came out with
They did.
that statement.
Yeah, so,
So I think number one, Joe, that we don't have an infinite amount of data. I think it's going to be something that we learn a lot about, the prevalence of this stuff. I think we're going to learn about the long-term effects of COVID on people, the longer people who have had COVID are out of it. And I think it's going to be very hard for us to make any distinct judgment about the risks and benefits of getting vaccinated versus getting COVID until we have more data. So
But
I'd be
what
very
we-
reluctant to not.
well, what we
encourage-
do know, and Patrick's made this very clear a number of months ago, if you're vaccinated, you probably won't end up in the hospital, and you're not going to die. That is what we do know.
Well, that's what they're even saying right now, that, and the CDC came out and said that basically everybody who's hospitalized now from COVID did not get vaccinated.
Really?
Yes.
Yes.
That's even better.
Yes.
Better. I'm sorry, Steve, go ahead.
There's one more thing that if I could address about some of the things that we heard about. Number one, in terms of testing. Most of those people getting tested right now are getting pre-operative and pre-procedural testing, and that is going away. At one of the hospitals in which I work, that is being abandoned as of Monday. And one of the other hospitals in which I work, I'm sure that will soon follow. That's following the state guidelines. So those numbers of 200,000 people getting tested, that's gonna blow up. There are only gonna be very few people getting tested. The second thing is that testing is still important if you're symptomatic. So because people are out and about, there's a lot of pollen in the air, people are gonna have a lot of symptoms of of COVID. And even though you're not likely to get severe disease, it's still important to get tested if you have clinical symptoms that are consistent with COVID.
I can add to that too. The couple of positive cases that we've had recently have all been asymptomatic people who are testing because they're going out of the country. And vaccinated people who, still test positive, completely asymptomatic, then they retest and they're negative. So, I mean, it's kind of, like what Max was saying, I think once the testing kind of winds down too, you won't see as many of that as well.
That's wholly expected. That is not someone getting COVID after they were vaccinated. That is not what that is.
No.
So I just want to make sure that's dispelled. That's not someone getting COVID after they've been vaccinated. That's entirely expected in someone who's got vaccinated against the disease. The PCR test that we use is so sensitive. It picks up small amounts of viral particles that are likely not contagious nor symptomatic. So it's just bad luck and bad timing that someone tested
Right.
positive if they're
That's what I
vaccinated.
was insinuating.
Yeah.
All right, so on to our regular everyday job, picking up again. And Steve,
Oh, actually,
take
can I
the reins on
interject?
this one?
Yeah, so with everything opening back up, obviously it's been a lot less complaints. So for the most part, at least my position has gone back to almost doing completely normal pre-COVID type work. Probably not helped by the crazy housing market, but septic has been pretty insane. We have about 11 open permits right now, and a couple of those are almost completed, but technically still open.
New homes,
New
failed
homes,
systems.
some are replacements for failed systems, but it's overall though across the board it's been pretty busy. We've had 2 so far that are in the ground, completely done. I think they were both for new construction, or one was for new construction, one was they were selling the house and they had a failed Title V. As far as restaurants go, the Friendly Toast, which is coming to town, is working through the plan review phase still. I found out, I think they have another location, I think it might be in Danvers, that they're also working on simultaneously, so that's why it's taking a little more time. We've been doing a lot of permitting and inspections, so with everything opening up, Stevens Coolidge has been having a lot of events. They've been having food trucks in there, so I've been coordinating those inspections with the fire department. We also had the farmers market coming, and that started about last Sunday, I believe. So we were wrapping up those permits. We've been dealing with a couple housing complaints and related issues. Pool inspections are almost done, and Other than that, we've been trying to get the sunscreen dispensers up, so we're going to work with DPW on that hopefully next week to put those at the public parks and Stevens Pond as well. And then I've been getting a lot of help too from our part-time inspector, Laura Vlasic, who's been able to take some things off my plate either while I'm out of the office or doing other things. So that's all I have.
Sounds good.
Callum?
Kind of the same thing, getting back to a little bit of normal, still doing some light contact tracing, but nothing too crazy. The numbers have been great, like Brian said, so I've been kind of chipping away at my Shingrix list and calling down my 40-something senior residents and trying to get them vaccinated, and then working with the camps that are getting licensed through town and doing their inspections and paperwork and stuff like that. I'm just catching up
So it
on.
looks like the camps are all going to open up.
Mhm. Yes, so they've been green lighted for residential and day camp, so just depends on what they do. Brooks is our big camp. They do probably 1,000 campers over, they have a day camp, they have a Broadway camp, and they have an art camp this summer. They don't have their residential camps this summer. They usually do a soccer one and a rowing one, which they aren't having this summer, so. And then we have a hockey camp as well.
How about the town pond, is that open?
That is opened. I drove by it today and I saw it open.
It is. Yeah,
So they have their
I
summer
think
fun.
that, I think the fee, the annual fee for town resident is $75, although I'm not sure.
I thought it was like 25.
For like
Yeah.
a season pass, I think he's saying, it is like, I thought 70, you mean for the summer?
Yes.
Right, yeah.
Yeah, but you can get them, I believe, for $35 at the senior center if you are a senior resident of our town. So you may want to take your kids or grandkids with you, I don't know, so. That is of interest. Before we move on, I read several different articles and was on the pandemic, and the appointments for cancer screening for cervix, colon, breast, and so forth were down 90%
Oh, I know.
in March. Yeah, so I'm not telling you anything you don't know, but I'm saying to myself, whoa, but this is so serious because these people, they may have cancer and they're not being screened, so can you
I'll
add
turn that one over to
anything to
Matt
that?
first.
I can speak to that. So at the beginning of the pandemic, there was a lot of work done about what was going to happen downstream from these lack of screening. And what the metadata that I saw said is that there would be 25,000 missed cancer diagnoses every month that the pandemic went on until screenings hit back to normal. And screenings didn't hit back to normal for at least 6 months. So the math is not hard. So it's over 150,000 missed cancer diagnoses that were made. And then it doesn't even speak to the fact that since we've returned, and even in my practice, there's great reluctance, or there was, it's becoming less, for people to come and continue to get screened in healthcare facilities. It sort of plateaued a little bit in the fall, and then again in January, February, March, and even maybe a little bit of April, there was reluctance to come in and get medical care because they were worried about the second peak. And now what's happening is that people who would usually have been getting screened, and I was already pretty busy, it's the catch-up which is happening, and so I'm not sure how I catch up, or how anybody who is in the screening business catches up.
How about you, Patrick?
We're more, in pulmonology, we're more bound so we do lung cancer screening CAT scans. And we're more bound by the hospitals that do the CAT scans. And what we're finding is actually the hospitals are backed up at least a month and a half to get in for CAT scans. Particularly because lung cancer screening CAT scans, it's certain software that goes into the computer, and they also have to worry about taking care of inpatients at these hospitals too. So we're finding that, I booked somebody today that was the end of July to have a CAT scan done. So that's what I'm kind of seeing from my end. I have to say the office is definitely ramping up for sure. I'm seeing a lot of post-COVID syndrome patients in the office, for sure. But I'm sure my bronchoscopies will pick up once the lung cancer screening CAT scans pick up, and be doing a lot more diagnostics for get diagnoses of lung cancer.
Anything else on that? On the virus? So several days ago, I spoke with Max, and my skin is pretty thick, and I said, look, what can we do better? What can we do smarter, and so forth? And amongst other things, he was saying that let's look at the short and long-term priority assessments that we have and so forth. And I said to myself, gee, this seems like a real good idea, because this past year, the focus has been primarily and to an extent exclusively on the pandemic. So on the short and long-term priority assessment, I'll turn it over to Brian in about 5 minutes. But I do have some comments concerning the pandemic. In particular, we've been very concerned in our town about implementation and enforcement of state regulations and assistance in getting vaccines, particularly to our elderly residents. I feel that our town has done an absolute stellar job, and kudos to all of you in the Department of Health. So it has worked out very well. I mean, I'm not saying it was easy, but we've been there, particularly for our seniors in our town. And advising all the ways up to the town manager, Melissa Rodriguez, and she's been in full support of this too. So the pandemic, to an extent, has subsided, and as we approach fiscal year 2022, now is a good time for our board and department to resume routine activities, as Brian said us a few moments ago. So going forward, our board meetings will be brief. They'll be focused, educational, and informative. In the past, meetings have gone up to 12 hours. Those that have survived the meetings may have felt like blowing their head off, and certainly no one is going to be watching after 4 hours, and in plain English, that ain't going to happen. that ain't going to happen again. But we will continue to have guest speakers, such as representatives from the Northeast Massachusetts Mosquito Control District, and at times member of both the Board of Health and Department of Health, and other people that work for our town and in our community. There'll be presentations obviously made on health and safety issues of concern. Also, we will routinely review, discuss, and if necessary, eliminate or update the Board of Health regulations. Timelines to be established. We can't do it right now, but how many regulations do we have in our town? And they're all put together by members of the Board of Health.
I jotted down some of them. They're in your packet.
Yeah, I know.
It's never ending,
It's never ending.
so you can read them if you
So
want,
there's not
by all means.
Well, I did, but there's not going to be a timeline because there are a lot of them, and I'm sure that we'll have much more to do. For example, you're saying that we have all these new septic systems coming in our town, and some of them will require board review and approval. So I think it's going to be a very, very busy time going forward, considering that we lost like a year, if not even longer. On several occasions this past year, I discussed a few of the essential health services provided by our board. And these and other services, well, matter of fact, let me just quickly go over them. It'll take me like a minute. Did you get that? Did you get them in your?
Yeah, they're in their packets.
They're in the packet?
Yeah.
Okay. So these are some of the health services that we provide our community. We monitor health status of the community, investigate and diagnose health problems and health hazards within the community, inform, educate, and empower residents about health issues, mobilize community partnerships to solve health-related problems, develop policies that support individuals and community health efforts, enforce laws and regulations. So we were, even during the pandemic, we were not into fining. I mean, geez, these businesses in our town, we have friends, we have relatives, some of us own businesses, our own businesses in our town, but a few people were slapped around for not doing what they had to do, and there were some minor fines, with the exception of one large one. during the pandemic, link people to needed personal health services and ensure the provision of health care when otherwise unavailable, evaluate effectiveness, accessibility, and quality of health resources, and the last one is research for new insights and innovative solutions to health problems. That in itself is a full plate. In addition to that, we as board members have a list of duties. It's a Massachusetts state list of duties. That is things that we have to do, and that has also been distributed to all board members. So as I said, we have our work to do. It's going to be a very, very busy year as I see going forward. I also want to talk a moment about the open meeting laws here in Massachusetts. Now, I mean, I can call Brian, or he can call me, or I can call Max, or Pat, or Steve, or Calvin. There's no problem. But when you have a quorum, and there are 5 members of the board, so when you have 3 members or more involved in the discussion has to be during the board meeting. You can't pick up a telephone and say, I don't like this, or I don't like that. If there was a quorum, one-on-one you can do it, but not, and correct me if I'm mistaken on this, Brian, but if you have a quorum, you can't do it. So it's not like in the dreaded private sector when you can speak with people whenever you want and have discussion groups and rehearsals, script and so forth. There were no rehearsals. There were no scripts. If you take a look at the agenda, there were just 3 or 4 things here: the elections, the short and long-term priority assessment, and the COVID-19-18. And that's it. That's it. But, you know, we've done this for a while, and we know what has to be done. So concerning the priority assessment, which I briefly discussed with Brian, Board of Health Director, I'll turn it over to him for his input, because he has a few things to say, particularly focus on task, accomplishments, and statistical highlights. So with that,
I don't get into stats,
whoa,
but
boy, this sounds really, really structured, doesn't it?
no. For the past year and a half, we've gotten hit with this pandemic, and it made us reevaluate everything that we do on a daily basis, for the most part. We want to strive to be effective and not just busy. We are super busy with the day-to-day responsibilities of the board, the statutory requirements of inspections and permitting and enforcement and all that kind of stuff. So we've been doing that for years. That's kind of what we're staffed to do. We don't have a lot of extra capacity to do more. We have some of that capacity now, which is really good. We're going to use that to the best of our ability to do some short-term goals, such as improving some of the policies that we have written already, maybe creating some new regulations, creating or rewriting some of the old ones that haven't been done since 1991. Things that we could improve upon that would actually help, such as issues with housing or local food regs. Right now, we work under the 2013 Federal Food Code, which was just adopted a year and a half, 2 years ago, which is even outdated at that point. They have a new food code that Mass takes a long time to adopt. So maybe filling in some of the gaps that we have with some local regulations to help us improve on the quality of our inspections and the criteria we look for and things we can do in that nature. Long term is where I want to focus some of our attention on. We've never done this, but it's called a community health assessment or a community health needs assessment. I want to bring in some experts and consultants to work on an overall assessment. The hospitals do them every 3 years. Lawrence General does them. They have to because they're a nonprofit. Holy Family does it on their own accord. They do them also every 3 years. It was 2018, 2019, I think, is when the last 2 just came out. But they have a large catchment area that doesn't necessarily fit the North Andover demographic. And throughout the pandemic, we saw a lot of shortcomings, and it kind of opened our eye to things that we didn't know we needed. Food insecurity was a big one. Health inequities, mobility and transportation issues, things that you thought were out there, but we didn't know the dire amount that was there. So I think by doing a health needs assessment, having somebody come in, it's probably like a year-long study, I think. Data, research, analytics, polls, public hearings. There's a whole huge component to get out there and get some information, get some data, and then come up with an effective action plan to counteract what your needs are. So we've never done that. Most towns don't have the capacity and staff to do it. I think we're in a position now where we can actually get it done. And that's my goal. I reached out to, I know Worcester did it years ago, probably about 5 years ago. They were getting some accreditation through the federal government, and that was one of the things that they had to do. So they brought somebody in, they had it done, and now they can come up with programs to address those specific needs. I don't know of any other town that's done it, except for the hospitals do their own catchment areas. But as a town and a local health department, it's a huge step. So it's a big lift, but I think that's where we need to go. I think we need to figure out what we need and then come up with action plans to address all those needs. And I know it's 3 of us, and Tony can't do it all ourselves, so if we can get somebody to do it, and we can work with them and come up with policies that you guys can implement, either through action policies that you guys do as a board, or recommendations that we make to you and you guys can then vote on, and kind of see where it goes. But there's a lot of things out there that we didn't know we needed, and I think now's the time to figure out exactly what those are and then address them.
How long would that take?
I'm hoping less than a year, 6 months, 8 months, somewhere in that area. I did reach out to the people that Lawrence General uses, Health Resources in Action. So I reached out to Lawrence General, spoke to their contact who does their needs assessments, and they go through Health Resources in Action. I have since I reached out to them as well. I'm waiting to hear back, and Andover is very interested in doing it as well. So I don't know if we can pool our resources to get it done for both towns, because both towns are fairly similar in terms of demographics. I think if we can obviously partner up with them, we'll have more staff resources and more financial resources to get the whole thing done maybe even quicker. But
I wonder if there is a grant or grants out there. I mean, the federal government is spending so much money right now. I heard that the cut that Massachusetts is going to get is like $5.6 billion or whatever. It's
regionally, I can look into that. I know we're going for a regional grant right now for epidemiologists and contact tracers for the fall. It's a $300,000 grant for the entire region that we're in, which is 9 towns and cities in the area, including Lawrence. But there's a need for it. It's a federal grant. If we get it, we'll have some backup nursing and contact tracers and case investigators. So if things progress in the fall and come back in any particular manner, we'll have the capacity to address that. Maybe we can roll in a needs assessment or another funding avenue for needs assessment with that as well.
Now, do we still have 3 part-time employees through federal money, CARES program, I believe, in our department?
Yes. We have an extra inspector and 2 extra part-time nurses. So the capacity definitely helps.
I'm just wondering if they can provide any help and assistance on
A
that.
needs assessment is very, very in-depth and involved, and I think you need to bring in somebody who has experience doing it to do it right.
Also, too, I remember that there were training programs in the past for new members of the Board of Health. They were voluntary. I went to one probably about 10 years ago with Dr. Frank Macmillan. He was a board member. It was pretty good.
I was just asking about that last week. I don't know if they're going to do them in person this year. They're usually in Marlboro, and it's a Saturday. So I think they run 2 of them. So I will definitely find that out as soon as I hear anything. You guys will be the first to know.
And
Trust
how
me.
about ServSafe? I know food certification accreditation, I think it's ServSafe or whatever it is.
Yeah. We were supposed to do it last year. Obviously, that didn't happen. We do it with the senior center. We invite restaurants to send their managers or staff. We do it through our food consultants that we use. And If you guys want to sign up for it, you're more than welcome to be Serve Safe certified, so you can run a restaurant.
That's
Great.
What, good for what, just 5 years?
5 years.
Yeah, mine expired many years ago.
Okay, so you have to re-up, no problem.
Yeah, but that was a pretty good program, though.
Your restaurant was pretty good.
What's that?
Your restaurant was pretty good.
Yeah, so that's our short and long-term goals. Catch up and redo some of the stuff we can do quickly and easily, and then long-term planning. I think the community health needs assessment is essential. I've been trying to get Merrimack College to help us with some grad students to do that, but haven't had any takers in a while, so
They don't have a school of public health.
they do.
They at the Merrimack College has a school of public
Yep.
health? Oh,
Yeah.
I can't believe, I cannot believe this is not right up their alley. I know that the Harvard and BU both have
Yep.
programs that they look for students to get in at. They look for them to do just this kind of thing.
Yep. So I've been trying to get them to do it, but no takers yet. I think their program's really small. It's just starting out
Yeah.
as of like 2 years ago.
Yeah, that's.
What about maybe like reach out to UMass Lowell?
Do they have a school of public health?
Yeah, they do.
I know a graduate.
There you go.
Yeah.
I can put a word in.
That would make sense.
MPH
The curriculum?
curriculum and briefly think about doing the MPH and then,
That's a great program.
oh, sure, yeah, my problem is my 2-year-old and my 5-year-old.
I gotta tell you, this is so exciting. I mean, I think it's very easy for a Board of Health to go to, it's very, to get mired down in the day-to-day permitting and review and the super important public health stuff that is sort of maintaining the status quo. And this is evolution of public health in a local community board, and I just applaud that you're willing to jump in. This is gonna be hard,
Yeah.
important work. I think that from a community needs assessment standpoint, the community needs, the reason that you can't just, anybody, you have to know what questions to ask in order to understand what the community needs. So it'd be very easy for me, for me to think that a community needs assessment would require things that I can see, and I would miss 90% of the stuff that's out there that the community actually needs. I think that being super transparent about it and making sure the community sees is visible, that they see what we're doing and that it's posted on a website and that they sort of understand what we're asking, why we're asking, what our goals are and how we're gonna achieve them will be critical to community support. And getting community engagement and having community people come in and tell us what they think is important, I think
Yep.
it's just great.
Yeah,
I think it's
there would definitely be
incredible.
stakeholder involvement in public meetings, public involvement. I can't think of a better organization than having the senior center come in and help out, because they had a lot of clients during the pandemic with food insecurities and mobility and transportation issues that we didn't really know about. And it was a fly by the seat of your pants kind of operation sometimes.
Yeah.
But it definitely opened my eyes, like, wow, we really need to do some of this.
So I'm gonna
and
tell you,
get this
Brian, I
stuff done
think
now.
that sort of says that you're the right person to be in the job you're in right now, because there are a lot of people who survived the pandemic and are
Yep.
gonna go back to doing what they did before. And
Right.
saying, we got through this, and the lesson that I think that you, and I hope that the board learned, is that the reason that we're able to do so well is because of you and the work that you guys did. And the reason that we'll do even better next time is because you're willing to do the work now so that next time you're even more prepared, and that you see a different pandemic coming before it hits, a pandemic of food insecurity, of transportation woes, of all of those things.
Yeah.
And that's preventive medicine. That's terrific.
Great.
You just mentioned a few moments ago, the Department of Health Services, the senior center. I stopped by there today. I spoke with the new director, Kathy, is it Shep? I might be mispronouncing her name, but very, very nice lady.
Oh, good.
And I said that we'll be working close going forward. Because we worked very close with her predecessor,
Absolutely.
Ryan.
Yep.
So I said, we'll leave you be because you just came aboard. But soon. And I said that you and I and other members of our board and our department will be working with her in the
Definitely.
department. So.
No, I'm looking forward to working with her.
Yeah.
I think, I remember we talked about this last summer, that would probably be a good idea that each board member, once the senior center really gets up and running again, to be able to do, each board member will be responsible for doing a lecture to the senior center, like at least once a year, topic of your choice, perhaps ideally a topic of your specialty, but to be able to kind of, just to keep the community more actively engaged with the Board of Health and offer our expertise to the community too.
Yeah, they started the lecture series again. I believe it's once a week.
Okay.
I'm not sure. I believe it's some money, but I may be mistaken on that. I do know that, it's probably about 5 years or so ago that Dr. Frank Macmillan, we know, but people that are listening in may not know, he's also a gastroenterologist. And so we gave a presentation from the perspective of one that has had colon cancer and his doctor, and it went very, very well. And I'm looking forward to doing something like that. I hope I don't have another ailment, but I'm looking forward to doing something like that again, So,
Great.
But that was a rough time, but, fine right now, no side effects at all.
Great.
But I should have had my colonoscopy sooner than
Yeah,
what I
that
did,
should
and you
trot you
probably
out more
heard that from
often.
so many people.
Try
Yeah.
go out more often.
Yeah. Is there anything else at all? Restaurants, you commented a little about restaurants. What can we expect going forward, right? Who's going to take over the restaurant where Frederica was?
That's the friendly toast.
Oh, that is the
Yeah,
friendly.
so that's
Oh,
where they're
okay.
like an all-day.
Okay, I
breakfast
wasn't
brunch.
quite sure if they were the
Yep.
one. Any other restaurants coming into our town?
Not at the current time. There's one that's going through an issue with, I think, another department just involving parking, but they're trying to work through that just to make sure they can go in, but they would be, I think, more of like, kind of like a breakfast type place. I think it's like geared towards vegan, vegetarian type food, and I think they do pressed juice, but.
I'm just wondering if there's going to be anything opening, or all the condos are being built on 125 near the Havel line.
There is one there.
There's Bird and Wolf there,
Yeah.
but they've been there for a couple months, I think, now. But as far as other places, I mean, you hear rumors, but I haven't heard anything myself, like concrete yet. So it looks like they still have space, but I haven't heard anything from anyone specifying anything. So
Yeah, we've got some inquiries coming in here and there, but nothing concrete. It was actually pulled the permit or applied for a plan review
yeah.
to get the permit process started.
Brian, a couple years ago, you was to give a presentation somewhere in the south, maybe New Orleans, I don't know, on the explosion that we had here in Andover, Lawrence and North Andover. And I know that, it was set back because of little things such as a pandemic that we've had. But
Yes.
you're gonna go forward to give that presentation or what?
I don't know. I have no idea. We were set up to go to Texas.
Oh, Texas.
A representative from Lawrence, Andover, and myself from North Andover. We're going to go do a presentation on the gas explosions and the public health response. We did it at MHOA 2 years ago, which is our Health Officers Association in Massachusetts. It went over very well, and we got asked to do it for the national conference. But so I haven't heard anything about that. I have no idea. I had a plane ticket and everything got canceled. So, that's it.
Thank you. Very good. Anything else? Wow, I mentioned meeting going over 4 hours, and this is a little less than an hour.
Perfect.
Terrific,
Great.
terrific. So we need a motion.
I'll let Max make a
I'll
motion.
send a motion to adjourn.
I'll second.
All those in favor say aye.
Aye.
Okay. Motion passed, meeting's adjourned.